Originally, we were thinking we want to know whether or not symptoms predict for length of stay. And so specifically, we went to look at other covariates that may confound the relationship between symptoms and length of stay to make sure we were controlling for those, because with this great data set, we can control for quite a few variables and still be safe with our data. So what we wanted to do was first make sure we're controlling for age, gender, cancer type. We made sure we have all those covariates controlled for, and then we singled in on specific symptoms to see what types of symptoms would predict for length of stay. So we first looked at symptoms individually, pain, nausea, fatigue, to see if those would correlate with length of stay. And we used the Edmonton Symptom Assessment Scale, a validated tool, which is 0 to 10, 10 being the worst possible symptoms, 0 being no symptoms at all. And we asked patients to rate these within 5 days of their admission to the hospital. If they were having a series of about 12 symptoms, we also asked them to validate the PHQ-4 to ask them about their depression and anxiety symptoms. And what we found when we looked at all of the symptoms individually was that essentially every symptom by itself predicts for length of stay, which is fascinating. So when people are having a heavy symptom burden, that predicts for a longer time in the hospital. It makes somewhat intuitive sense, but it also is really great fuel for future intervention studies. When we put all of the symptoms in the model with the study that we're presenting here, we found, so controlling for all the other symptoms that may be interacting with other symptoms, because symptoms there's been literature showing that symptoms cluster together, we found that pain and depression individually, independently, predict for length of stay. And it's very interesting. We ended up dichotomizing depression, yes, no, and pain, yes, no, using validated cutoffs in order to get a better idea of how much longer would the length of stay be for patients with and without those symptoms. And it's an extra day for both of those symptoms, which when you think large scale, an extra day in the hospital is costly, affects quality of life, affects survival, affects recovery afterwards. So it's actually a really important finding, that an extra day in the hospital by someone that has these symptoms versus not having these symptoms.